Okay, good morning and thank you very much for joining us. I am Iyori Folari alongside this morning. Um, well, he's reminding me that it's Asukwa James because I'm trying to find out, is it is it the other guy with Asukwa James?
Yeah, good morning, Nigeria. Good morning.
You know how it is. Sometimes a thing will slip. Sometimes my own name slips. You know,
Wow, that is
Yori. Yeah, I think it's Folari. Okay, we're still in the thick of COVID-19. The doctors, the warning strike by the doctors in Lagos, supposed to be for 3 days. That's supposed to end on Wednesday. Today's the third day, right? But in between that, when they announced it and now, there has been some response from government. We'll be hearing about that later on. We'll be speaking, hopefully, all other things being equal, with the Commissioner for Information in Lagos State. Besides, in the meantime, we've heard that it's a big misunderstanding, a big communications gap. Lagos State doctors are not being treated poorly. We'll hear about it when that time comes. The other thing about COVID-19 is, you know, the figures. The figures, we are hearing that it's going up. We are worrying that our capacity to test is affecting the figures we're getting. What would happen if we were able to test a lot more? What would happen if, just take the statistical possibility of being able to test every Nigerian? What would happen then? Well, there's a man who can help us out with that. His name is Mr. Clement Odo. Mr. Odo is a data analyst. And thank you very much for joining us, Clement.
Oh, thank you very much.
Okay.
Really, when it comes to the testing capacity of Nigeria,
Sure.
with the current figures, I believe we are not really doing much. The country Nigeria is underperforming. As of today, Nigeria has a total of 186,309 tested samples or tested individuals. And if you look at this, you will find out that even the total laboratory tests that we have in the country is not up to 36. And if you look at this, most of the functional testing laboratories, they are majorly in the southwest, especially in the area of Lagos. And as we progress from southwest down to the north, we see that we are having limited and non-functional lab facilities and lab systems. And that is why you see in the country we have more tested samples around the southwest, especially Lagos. But
okay, let me just go over the figure you just gave us. You said almost 190,000 cases.
186,000 for sample
I
tested.
mean,
Yes.
Yes. I mean 186,000 sample tested.
That's
309.
okay, that's what I meant. I just rounded it up to almost 190
yes.
tested. And then you said the testing centers, you said we have about 30,000 testing centers.
No, I mean just test 30. I mean just 30, barely 30.
Oh, 30. And if we were to look at the average of that, even if we were to look at the average, if we were to look at the average, it's a humongous number, you know, statistically, from average of how many centers we have, testing centers we have to those people.
Yeah, but really, it's not all of these testing centers that are functional. And that's why you see some part of the country, you will have to perform a particular test from a particular state, and the test will be taken to another state for examination. And this is really having the effect in the testing capacity of the country. I mean, if you compare this with other countries, I mean, you talk about just 2 days ago, a state in the US, which is California, did almost 145,000 tests per day. And here is Nigeria. In the last 5 months, we have just done 186,309, and that calls for a concern.
But isn't that a function of the facilities that we have at our disposal? Things like money, things like infrastructure. How do you explain it as an analyst?
Yeah. When you look at the testing infrastructure, yes, basically we have found that even from the World Bank, we have, when this pandemic actually came up, we have that almost all the country feel all the citizens could be tested. But over time, they find out that, of course, it may be a bit resource consuming to have all the individual tested. But as a result, we still have some countries that believe that all the citizens can be tested, and that's actually for the developed nation. But for countries like ours, okay, of course, we have a lot of assistance currently that could afford us to have those infrastructures that could enable, a good number of Nigeria tested, but we are not actually working with that. So that is a problem.
So if we are to say, for instance, all Nigerians should be forced to get tested, what will it cost the government? Will it cost the government the harm and the head and everything?
Oh, really? What really happened? Before I go into that, let me quickly give you, show you from data,
Okay.
what the figures we have in terms of testing capacity. Can we see my screen, please? I don't know if you can see my screen.
Yes.
Want to project. Okay. If you can see what I'm projecting on the screen, can you see it, please?
Yes, we can.
Okay. If you see what I'm projecting on the screen, these are basically the total figure when it comes to testing capacity per country. All right? And when you carefully look at this, what you have on the top here,
Okay.
what you have on this top here is the testing capacity per country, per continent. And what you see here in Asia has the highest testing that has been done ever, followed by Europe, and it actually goes like that as we have, according to the number of population per continent. But let's go by
Clement, you're going to have to help us a bit. Because these are graphics for your computer, they weren't specially made for television, we can't read them. They're too tiny, too small. So could you please tell us what all those bars represent, which countries they represent, and what the numbers are?
Okay.
All right. The first bar you see on the right, the largest bar, represent Asia. And Asia has a total of 135 million tested samples. All right. And the second bar, which is this, is Europe. Europe has a total of 73 million tested samples, and North America has 449 million tested samples. And this next one here is we have Africa. Africa has just 6 million, and Oceania. But let's go quickly by country. That will give us the picture, a clear picture. What we see here by country, the highest number tested so far is from China. China has conducted a total of roughly, just 9 million tested samples, followed by US.
Okay.
US.
Clement, sorry to interrupt you again. Could you just tell us, please, what the populations are so we get a better sense of when you say 9 million have been tested and they have a population of so many million? 2 million have been tested and they have a population of, that might be helpful. Okay. Thank you.
Yeah, that's very good. Oh, yeah. When you look at this gives us the total picture of what the point I'm just trying to make. As I just said that Nigeria is really underperforming when it comes to testing, and we have a lot of resources that could enable us to carry out this. All right, what you have here, this is China. China has a population, this is the population of China, about 1.4 billion. Actually, testing is actually looked at in terms of per million or per thousand population. That's why you see here, the first we are looking here is the continent, and this is the rank of the countries in terms of the testing capability. And this is the country, and this is the number of tests that each of these countries has actually conducted. And here we are looking is the tested per million population, and the confirmed cases is this, the death is this, the population is this, and the last column here is the GDP per capita. Now, when you look at the first here, it's China that has conducted 19 million. 90 million, the population of which it has is 1.4 billion. When you look at this ranking,
what kind of a percentage is that?
What percentage is that?
What percentage is that?
The percentage of the test, when you are testing per million,
okay.
per million, like you see here, is 62. This is what you are seeing here.
Okay.
62,814.
Okay.
But I don't have the real percentage
Okay.
on the data here. But when you look here, you will see where Nigeria is positioned. If you look closely, you would find out here that Nigeria is at number 79.
Okay.
I mean, when you look at the tested, Nigeria is ranked 79. That's why you can see here. See, Nigeria is ranked 79 in terms of the countries with the number of tested samples. And then when you look at Nigeria in Africa, where Nigeria stands in Africa, you would also find out that there are a lot of countries that are very far ahead of Nigeria. Even the fact that Nigeria has, Nigeria has the highest population in Africa. But when you compare the total tested sample, we are way far below. Nigeria is 9th in Africa. That's what you are seeing on the screen.
Wait. You can see it. We can't, for the reasons I explained before. In terms of per million, Nigeria is doing how many testing per million? The statistical.
All right. That's why you are Nigeria is 903 when you rank them per million.
Per million.
And you would see here also.
Now, sorry, Clement, beg your pardon. Just for example, our neighbor, our brothers, Ghana here, they have a much smaller population. What are their figures?
Yeah, you can see here, Ghana is just very close to the first country, which is South Africa. Ghana is third. And being in that third, you can see the population of Ghana is just around 31 million.
And they are testing how many per million?
Yes, when you look at this per million, in Ghana here, is 10,658 per million tests.
Compared to Nigeria's 900.
908. And you can see why I'm saying that we are really underperforming, and we need to ramp this up in order to test a lot of people. Because the more you test, the more the capacity you have to control this pandemic. And that is why I am coming up with this, that in Nigeria, we are not really doing much. We really need to ramp up the number of tests, because I believe we have that capability.
Well, we do have the capability, but we also have, relatively speaking, a humongous population. And that's why I asked for the figures in Ghana. And as you said, Ghana, what? Well, the population you gave there is about 33 million. 33 million odd. And they are doing very well. I mean, that accounts for almost, it's nearly like Lagos population. Like if we could just stay in Lagos and say all of Nigeria COVID-19 is in Lagos, which it is not. You understand how, this is the thing with statistics. I don't know, sometimes you have a problem of trying to compare like with like, and that was why I was asking for those extrapolations as to what it means in terms of proportions and percentages. But it still isn't very encouraging that you've explained to us that, look, we per million will be looking at something like 900, sub 1,000, as opposed to other people that are doing much, much better than that, 10,000 in the case of Ghana.
Yes, and even if you look at a particular small country like Mauritius, has a population of about 1 million, they still perform higher than Nigeria. Now, what do we say to that? They have almost.
I would have thought it's easier for them. I would have said if we had 1 million population, we'll be first.
Hello?
Yes, sir. We can hear you.
Yeah, but I also know that with the resources Nigeria has, we can, as a matter of fact, handle more testing. Okay. Because the truth is this. The truth is this. If we don't test enough, it means we are not discovering the number of people who have this COVID-19 enough. Okay. And as we are not actually handling them quite all right. So the more testing we do, the more cases we discover.
How much does it cost to test? Can we sort of now begin to understand what the restrictions are? How?
All right.
In plus and minus.
Basically, from what we get is that when it all started, like I said before, all countries, they wanted to test all their citizens. But with the limited resources, I find out that some countries cannot even do this. And that is why we have some developed countries. They have to come to the aid of the developing countries. And that is why we have been actually having a lot of assistance from governmental organizations and non-governmental organizations across the world. And in fact, just a few weeks ago, we learned US has given us resources worth about 16 billion to actually fight this. I mean, these are resources. And when it comes to the figures, we know that to test one person using a particular, as is WHO recommended test, which is called PCR or swab test, it costs about $125 per test, and that's around $49. I mean, 49,000 naira. When you convert, yes, around that amount, and that is for PCR test. And if you have to test the entire nation of about 206 million, it's going to cost roughly 10 trillion naira. But there's another test they call paper test, and this paper test costs just $3, which is about 1,200 naira. And if we have to alternate our testing to this paper test, and you actually calculate it by the number of population we have, number of people we have in the country, 206, we are going to spend closely 240 billion naira to test.
Well, the challenge here, the challenge here is that it also leads to what I was going to ask you, where you get your figures from. Are you working with official sources? And when you mention that technical matter of a paper test, one wonders what the pros, what the experts, the medical professionals, what they think about these summations that we are making, and whether indeed a paper test can be substituted for a regular test, and some of the other parameters that were added. In short, are you working with authorities, medical health authorities, with these figures? And did you get them from them? And do they have any comments on them? Have you made this presentation to them?
Yes, actually, I work with a governmental organization. I work with the federal government of Nigeria, and the figures are just everywhere. And this, my data is just from relevant sources. I mean, I got my data from World Bank, I got my data from NCDCs, and I got my data from reports that are updated online from either NCDC or WHO, right? And but currently, like what you just said, paper test has not been approved. The approved test is a PCR, which is
what is a paper test? What is? I know you're not a doctor.
And how does it even work?
Really, I like you say, I'm not a doctor. I cannot go deeply into that. I'm just a data analyst.
Okay.
but in other countries, in other clients, are they using the paper test?
For now, the paper test was just, I think, a stipulation as alternative to the PCR test, which it seems to be a bit expensive for Nigeria to carry out.
Okay, this is all very interesting to know. And you've explained that well. The sources are good. Michael has called in from Mowe. Good morning, Michael. I just lost Michael because, as you don't need me to tell you that the source is everything in compiling data like this. And so I was a bit concerned when you said we get our data from everywhere. I mean, you know, people everywhere can sometimes not be sufficient statistically, that kind of a thing.
That's true.
I even wanted to ask, is it possible for us to, I know because we've not even achieved 50% capacity in terms of testing, is it possible for us to achieve at least 50%?
No, what's that figure he mentioned? How many trillion did you say we would need if we were to just...
About 10 trillion.
About 10 trillion?
About 10 trillion.
About 10 trillion.
Which you know we don't have. I don't think, if NEPA had 10 trillion, if the whole NEPA project, if they had 10 trillion, I guess things would be slightly different.
Look, actually, when it comes to that, if you look at, I know that we have generated enough income in this country. I mean, when you look at the looted fund, we've actually recovered. Of course. And then when you also look at the revenue generation from our exports and a number of other sources Nigeria make its resources from, I believe if the goal of federal federal government and SCDC is to test all Nigeria. I believe we have.
Okay, now let's get a professional, as you said, you're not a doctor. Let's get a doctor. Dr. John has called in from, I believe it is Taraba. Good morning, Dr. John.
Good morning.
Thank you for calling in. Go ahead. Did you have a comment?
Right. Yes. First of all, I have to clear up an issue here. I am a doctor of statistics. I am not a medical doctor.
Oh, okay. Oh, okay.
Yes. Yeah. What the data analysts have been presenting is outstanding. He is actually giving a clear cut about the situation we are finding ourselves right now with the pandemic. You have to understand that our testing capacity is very, very low compared to many African countries, which he has shown from the graph. I also want to clear something here. The amount for testing, which he said about 49,000 or so, I think that is not too big enough compared to the palliatives we have received from different organizations to fight the virus here in the country. If you look at it, the money we embezzle in this country is even far more than what we are supposed to spend in tackling this testing issue.
Okay.
Now, from before now, we observed that the testing centers were very few, not until they had to increase other testing centers. We were hoping that with that increment, there will be a large number of people who will be tested. But till this moment, we still find out that samples are taken from one state to another. You can't continue in such manner and expect to achieve a positive result.
Okay.
I want to clear this again. Right now in the country, about 40% of death is linked to this virus because most of the people who are dying now don't even have access to hospitalization and other medical attention.
Okay.
Because we have had many cases where patients go to the hospital, they tell them the hospital is already sealed up, no bed space, and all that. They get back home, they can't be taken care of, and they die. And I tell you, most of these deaths are linked to it. Just look at what happened in Kano previously before now. Even when they refused to make it clear, but after the whole investigation, they came up with a report and said most of the deaths were linked to the virus. And that is what is happening now across the country.
All right, then.
So the government have to step up. They have to step up their game. They have to increase the number of testing centers. In fact, all government hospitals across the country is supposed to have an isolated lab for testing. So if they have that, then the number of cases of samples that will be tested will definitely increase in a rapid state.
Thank you very much, Dr. John. Thank you very much for calling in, and thank you also for the clarification that you have a PhD in statistics. You're not a medical doctor, and you are sort of attesting to the data. It will be very helpful to hear from, because some of the questions that we were asking, for instance, the paper test. Why wouldn't we go the paper test way if indeed it is effective? So these are some of the things that we need to know. But at least the two statisticians are agreed on the fact that
the numbers are worrisome.
Are worrisome, and that it is their opinion that we can do a lot more than we are doing. Now, the Nigeria Center for Disease Control, they probably are going to be very highly interested in this subject matter. They must also, and there must be a whole wealth of data. But our resource person says that, look, I'm a government worker myself. My statistics come from government, among other places. It's interesting, but the 10 trillion figure, the 10 trillion.
That is like our budget. That is like our budget.
Yeah, even though, the money that, the late Abacha saved for us, people are now looking at that.
But I think there's nothing bad if we can, look for how we can allow so many people get tested.
Let's go on a break, because that would be the ideal. Let's go on a break. Okay, welcome back, and I wanted to use this opportunity to thank our resource person, Mr. Clement Odo, and our data analyst, as well as your colleague, the statistician, the PhD, Dr. John, the PhD in statistics, who also sort of attested to a lot of the stuff that you were saying. Thank you very much, Mr. Clement Odo, for coming on our program.
You're welcome.
All right then. Now, continuing with the program, we'll relate back to this because we're talking about COVID-19, the figures, and we'll also be looking at the other aspects of it, the healthcare, the doctors in Lagos State. But let's start with a report by Adedoja Salam Adeni before we come back to studio.
The list of the doctors' grievances varied from shortage of doctors in the state, heavy taxation of health workers, request for residential quarters and hazard allowance for health workers to COVID-19 insurance cover, among others. Governor Sanwo-Olu explains one after the other.
Our government was the very first government in March that started paying hazard allowance to our entire health workers, almost 20,000 of them. And what did we do? For the hazard allowance, we increased the hazard allowance by 400%. We also now realize that we needed to give the front line in the COVID-19 pandemic, we needed to give them additional incentive. But as we go along, we need to also review what our strategy is. Our strategy was at that time to curtail the pandemic as soon as possible. So we paid an allowance in our view, that was actually rooftop. We actually paid people allowances that was like twice their salary, right? And so part of the strategy is let's keep the hazard allowance, on months in which we feel comfortable, we continue to pay it. And just last month again, we paid it, right? However, the COVID allowance, we needed to do proper enumeration. We needed to be sure that the people that were going to be paying the COVID allowance to were people that had worked during this COVID period and had worked in one or all of our isolation centers. All of them, most of them, if not all of them, have gotten the allowance for the 2 months arrears. All of them.
The governor also cleared issues pertaining to residential quarters and heavy taxation.
We have 2 developers that were commissioned to even want to build accommodation for health workers. But even if we start today, minimum is 24 months because we have delivered that. So to build accommodation is not something that you say to me, I've not built, and I'll say to you, go to sleep and wake up, there is an accommodation there. Taxation and salary deduction is a function of law, and there are things that are allowable, there are things that are not allowable. But even at that, we said, let's even further look at it. What savings, how much tax can I tax an officer? Maybe at best, maybe it's 5,000, 7,000, 10,000 are these figures that we're talking about. And we said that once we call the chairman LIRS, we'll sit with them and they'll resolve. I cannot just take a unilateral decision on tax.
The state government noted that it was worrisome for medical professionals to down-tool at a time their services were most required. Adedoja Salam Adeniyi, TVC News, Lagos.
Okay, it's interesting. I don't imagine the governor would be very amused if I were to remind him that in China, they built a mammoth hospital in 1 week. 1 week, that was an emergency. Mm-hmm. Funds were unlimited.
Even though it was a collapsible...
but
at least they built an isolation center.
So it's not quite the same thing. It's not quite the same thing. But there you go. The governor was sort of explaining this the way we understood the whole doctor's situation. And apparently, I don't know how you see it. It's a bit of a misunderstanding seemed to be what government wants us to understand.
Exactly, because I remember when on Sunday when the Medical Guild had their press conference, they said they even gave the government ultimatum about 14, then 21 days ultimatum. So I was wondering why didn't the government actually, avert this warning strike, that happened on Monday and it's ending today anyway.
Yes.
So it's something that they would have sorted out even before the warning strike. And if you look at some of the things, some of the grievances,
It points to a communication gap, which we heard yesterday was the government's position that this is a very unfortunate communication gap. But at least that's what the warning period. The governor was saying in there that this is not the time, that we expect the doctors to go on strike. But since they themselves had said that it was a communication gap, and he apparently was filling that gap. Because we heard these interesting figures that Dr. Lubogi was giving us the figure that federal doctors reportedly were getting in the 300,000.
Yes.
And Lagos State
Throughout
doctors
I think it's throughout the period, the COVID period,
had got so far
25,000 or thereabout.
about 300,000.
Yes, that's the federal
yeah,
doctors.
so that's where the figure 300,000 went and came in.
Yes.
And I don't know, when you divide up that figure by as long as we've had COVID with us, COVID-19 with us, maybe it isn't as sensational as it sounded.
But the thing is, they've been paid.
They've been paid. That was the point.
Yeah, they've been paid.
But
for Lagos State, I think he was saying something about in the region of 25,000. And I remember when the president actually said there will be like an hazard allowance for doctors. So many people were saying, Lagos should be able to increase it a bit, and make it worthwhile. And so when this warning strike actually came out, even the ultimatum, so many people were taken aback. That why should it be Lagos? And that was why it's good that the governor has actually come out to clear the air over it, and that the 2-month salary being owed, the doctors have been paid, because I know as of yesterday, I heard they've been paid. So we should be looking at other issues,
okay.
The other issues around it.
Mr. Ali Kolo, good morning, sir.
Yes. Good morning, how are you?
Very well, how are you?
I'm fine.
Go ahead, please.
Please, I just want to... Yeah. Yes, how are you? I'm fine. Okay, I want to talk about the doctors.
Mr. Kolo, you're going to have to kill the volume of your TV set.
Okay, let me reduce the volume.
Not to reduce, mute it. Pata.
Or you switch off your TV.
Or switch it off, sir.
Yes? Okay. Okay, yes, I have done that.
Oh, thank you. Go ahead, please.
I want to talk about the doctors on strike. This issue is from the government side. If they were paid very well, they cannot go on strike. And you see these people, you can see the magnitude of their work and very, very importance of their work to human life. So, government, you can see diverting other funds to other sectors rather than bringing the money into this very, very important sector. When you hear doctors are on strike, you see they were not compensated or they were not paid the way it's supposed to be done.
All right.
This is a problem in the country.
Indeed. Well, thank you very much. Appreciate your call. We're going to break. Please stay with us. Okay, welcome back, and we were talking about the challenge of, well, first of all, the strike. This is the last day of the strike, and in the light of the governor's and the government's explanation, that's what the strike has done. It's brought forth communication. I imagine that there will be no need, because we're talking about what a warning strike does. So it was to call attention to the fact that the doctors were not quite satisfied. And this has been addressed. We've heard that it's a communication gap. We've heard that the doctors are not going to be shortchanged. It is not the intention of government to shortchange them in any way, shape, or form. In fact, if it's like government's position is that if not for this communication gap, there wouldn't have been a need for the strike. And Mr. Alikolo has called in to say that resources seem to be diverted to other places. But we don't know how the matter is. We do know that Lagos has always taken this operation headed by the governor and the deputy. You know, they've been at the very, very top, at the very, very front. They've always taken it seriously. So that's why you say a lot of people were surprised to hear that, what? Doctors in Lagos State are complaining? And we thought we were being led by the governor. And if you're being led by the governor, how can this kind of a thing happen? They say miscommunication.
Exactly. That's why we are saying that the other issues around it is what the governor should also look at. You know, apart from the salaries, hazard, they also complain about the hazard allowance, you know, and insurance, and especially the PPEs, you know, for the health workers. And good enough also, yesterday,
PPE being
the personal protective equipment, you know, so good enough that the governor also did something that was laudable yesterday, you know, the tree planting for the year. He dedicated the year for tree planting to the health workers, because they've been the frontline workers in this COVID-19. And I think the doctors should also look at that the governor is not leaving them,
that they are
he
sort
still
of
has them
valued.
they are highly valued.
Let's take Michael in Mowe. Good morning, sir.
Hello, good morning.
Thank you for calling in.
Yeah, actually, I have interest in your discussion so much this morning. And what the issue on the paper, the analysis, the other caller was saying that our government can also as well do a lot of things in doing it. If it can work with the money diluted in connection with the other government agencies, at least we have other resources to maximize what they are talking about. Though the issue of this COVID-19 is real, we all know that one. But government can also assist. At least even though all the citizens are not getting the palliative across to them, they can as well maintain this one and get the testing in all places for everybody.
Thank you very much, Mr. Michael, for your call. Indeed. Michael going over some facts there. We know it's real. Of course it is real.
Yeah. There are some people that don't believe that.
Yeah,
it's real,
That's
but people are dying. So far, about more than 700 Nigerians have died.
You know, it's a very, very...
And all over the world, about more than 500,000. You know, so people should not say that people have not died. We have brothers who have died. We have colleagues who have passed away. We have people that we know that are important people who have also died because of COVID-19.
You know, an area of very, very high, very, very, very high controversy is, you know, another stream of thought that is coming out that the coronavirus is being exaggerated. The facts and figures are being exaggerated. So would one stream go. But governments, including, and apart from governments, the World Health Organization has no patience with such theorists at all. You know, but for whatever it is worth, they still are going on that this thing, you know, it's a whole, it's not as bad as it thinks. But that kind of an idea is frowned on so very much that there are actually societies that would criminalize, you know, any such such opinions. And for YouTube, for instance, and there was aspects of the social media actually shutting down sites that are speaking or publishing stuff along those lines. I guess the greater wisdom in the world is that, you know, it's too narrow a stream that this whole matter is a conspiracy. It's among the pharmaceutical giants. They call Bill Gates' name. They called world governance name. No, they say, look, these governments around the world, headed up by the WHO, are saying that it is a very, very big problem, and it's almost criminal for anybody to try to de-emphasize it. Good morning, Mr. Joshua. Thank you for calling in.
Good morning. Good morning to our super James.
Good morning.
Yeah, for testing, my question is, are we testing to treat people or just testing to count numbers?
Testing to know the extent of the problem so that we can know what resources to bring to it.
The extent of the problem is if we have a pandemic That is how far it can go. Pandemic means it's already everybody's problem. I think the emphasis for me to the handlers of this COVID matter to go along the line of personal responsibility. All these things we're talking about, there's nothing that is ever going to be enough. You know, and when you are dealing with human beings, asking them to comply to particular patterns is always very difficult, if not impossible. You test, you ask people, you hold some variables constant. If I have tested you, I agree that you are within this environment. The person you have tested moves to another environment where testing is not being done, and he goes into the same risk. Are you going to conduct another test on him? Or are you testing to ensure that the moment you are tested and you are confirmed positive, you are treated immediately? And then this testing goes wrong, you know, massively, like almost at the same time. My issue is let's advocate personal responsibility on this matter. It's going to help us to go further than what most people are doing at the moment. Thank you, sir.
Thank you very much for calling in. As a matter of fact, we thanked Mr. Clement Odu, you know, but he still is with us this time he's on Zoom. So even as calls are coming in, I wonder if Mr. Odo, if you'd like to comment in the light of some commentary that has come in since.
Yes, definitely. I would like to comment, especially the last caller, on what he just said. Really, what happened is that when it comes to testing, like I've said before, the more you test, the more you realize the number of people that are having it. And once you identify who is having it, the best is to isolate the person. That is why we have isolation centers. But there are some people whose symptom is not so severe, so they could actually isolate themselves within their place of abode, if they can have a place where they would actually keep away from others. We have seen that. So the goal of testing, I mean, look at Nigeria, for example. If you look at Lagos, we see that almost 38% of all the cases in Nigeria, if I am correct, they are from Lagos. The point is it really true that Lagos or Southwest is having the highest number of infection in Nigeria? To me, the answer is no. Why we have this number is because these numbers are documented and recorded. Because if you look at the World Bank statistics, and we see that illiteracy level increases with with infections, and the number of households, it actually increases. And also the population also tend to increase with number of infection. And that tells you and I that as you move from southwest down to north, you see the correlation is actually more, because the more you go there, the more you see the illiteracy level, and then the graph is just a linear graph. So, but what we see is that the negative side of this is that in Lagos we have more testing, and in the north we have less testing.
Okay,
so
one moment, please. One moment, please. Let me bring in Juliet, calling in from Aja. Good morning.
Hello, good morning. Good morning.
Good morning. Thank you very much for calling in. Go ahead, please.
It's about this doctors stuff. Doctors are not really supposed to be going through what they are going through right now in the hands of our government. It's because we are not prepared. We take everything for granted. Our leaders take things for granted in this country. So doctors are passing through a lot, especially this period. And I beg the leaders of this nation, they should please take care of our government, because our doctors, because they are the ones that is standing by people.
All right.
They should try. They should try. The government should please compensate them. They need real compensation, especially this period, because it's not easy.
All right, then. Thank you very much for your call, Juliet. Appreciate your call. Going back to Clement. Clement, you stumped me for a moment there. You say the figures are indicating that Lagos has the greatest number of cases, but you say
exactly.
You say you don't necessarily believe that that is the facts. Well, don't you derive the facts from the figures?
Okay, really, let me quickly point it out from data, and these are data from NCDC. Let me just point them out to you. Here we are having Nigerian statistics, and what I don't, if you can see my screen, you see this is everything about the Nigerian figures, and this could be a bit counterintuitive, but these are these are facts as long as we know it. I mean, this is how all the cases in Nigeria are distributed. What you see here, let me blow this out so that you could actually have the picture.
Very briefly, please. We have about 40 seconds left.
Oh, okay. You see that 50% of all the confirmed cases in Nigeria is from Southwest. And if you look at the number of tests, you will find out that Southwest has the highest number of tests. So what I'm saying is that the reason why you see this is because of the aggressive testing campaign from Southwest, especially Lagos State. When you go through the north, I believe there are more cases in other parts of the country, other states that we have in Nigeria. The only difference is because in Lagos State, the cases have been documented, but other parts of the country, the cases are not documented, so you can't easily identify them.
Okay, so that theory needs to be tested by indeed bringing testing to those areas so that we can then begin to talk of it as a fact. I want to thank you once more, Mr. Clement Odo. Really appreciate your coming on a second time and helping us out with understanding those figures. Thank you very much. Well, so that brings us to the end almost. There's still some calls that we're trying to get in, but we couldn't get them in. Our apologies as always. Keep on trying, and you know, maybe tomorrow will be a better day for you to get in. So that's our program today. Please keep safe. Keep up all the protocols because it is here, it is real, even though there are theorists saying that it is being exaggerated.
Exactly.
Not many people are paying attention to them, even as they have the right to free speech.
Exactly.
So that's our program today. Please join us tomorrow for a fresh edition. I'm Iyori Folare, and I'm sure Asukwa also wishes you to be safe.
Yeah.